Hello, this is the debut of Indiana Trails TV, a video interview series focused on trails and trails-related content created just for you. I'm Gary Davis. Our guest today is Dr. Terrell Zollinger, and Dr. Zollinger graduated from Loma Linda University in California with a master's degree in biostatistics and a doctorate of public health and epidemiology. Dr. Zollinger is currently an emeritus professor of epidemiology at Indiana University and with the Richard M. Fairbanks School of Public Health and Indiana University School of Medicine and Department of Family Medicine. While on the faculty at IU, Dr. Zollinger served as Associate Director of the Bowen Research Center and Director of the Epidemiology PhD program and the Division Director for Epidemiology and Environmental Health in the Department of Public Health in the IU School of Medicine. His fields of research specialization include health services research and evaluation, health risk factor research, and health professions workforce studies and health disparities. He serves as a research consultant to hospitals, health departments, managed care organizations, and other health-related organizations, particularly focused on health services, research, and evaluation. He's been the principal or co-investigator on 130 grants and contracts and the author and co-author of 91 articles in peer-reviewed journals and 303 contract technical reports and 185 conference presentations. That's an awful lot of work. Dr. Zollinger, welcome to Indiana Trails.
Thank you very much. I appreciate it.
Dr. Zollinger, you are an epidemiologist. Can you tell us exactly what the field of epidemiology is about and what an epidemiologist does?
Sure. Well, the word epidemiology is the study of epidemics. So what we do is we collect data about cases of disease or injuries in humans, and we want to look for patterns of who is it that's getting sick and what are the risk factors. So we might be interested in looking at patterns of disease by the age of a person, whether the people who are getting sick are older or younger or children, whether males or females. We'd like to know what the symptoms are of the person because that'll give us some idea of perhaps what's going on, whether they're having respiratory symptoms or whether they're having gastrointestinal symptoms. That gives us some idea of whether there's something that they're breathing in that's causing the problem or something that they've eaten that perhaps are causing the problem. We also look at where those cases are geographically. Are they in rural areas and urban areas, or is there some other pattern that we might be able to see geographically that helps us? And of course, we also look at time patterns. When is it that they're getting sick? Is it in a certain season of the year or a certain part of the day? You know, what could actually be the time patterns that are there? And so here's what happens. We look at all these data. And we look for patterns, we see some patterns, and we start thinking, aha, I think I know what's going on here. You know, and you start building a hypothesis about why you think certain people are getting ill and why some people are not getting ill. And so what we do at that point, once we have some hypotheses or some ideas about why people might be getting sick, then we'll work with other scientists to test our hypotheses and develop programs then that hopefully can prevent the disease. That's what epidemiologists do.
That's a very good description. What is your professional experience studying the role of physical activity to promote physical and mental health? And we're going to get a little further into that here in just a minute, but maybe
absolutely. Absolutely. Well, thank you. Actually, I've conducted a number of studies in this area looking for certain types of relationships. For example, one was study that we did looked at the role of physical activity in helping to prevent certain types of cancer. Colon cancer is one that we included, and we also found that there's a preventive factor to prevent breast cancer, which was useful. We've also worked with the Indianapolis Fire Department to how to measure physical fitness of the firefighters of individuals who apply to be a firefighter first, to see if they have the physical endurance and flexibility and strength that they need to be a firefighter. And then we developed a program for them to assess their incumbent firefighters on an annual basis to make sure that they're still able to do the job physically as a firefighter. So we developed some guidelines for them to help them with those types of concerns. Worked with several communities to find out what the level of physical activity was among the residents in the community. I did one study that was interesting that looked at the role that exercise plays in helping women with depression, which is important to know. And we're going to talk, I think, a little bit about mental health in a few minutes. Conducted a number of evaluations for programs that were trying to improve physical activity among people. Did an interesting study where we were helping physicians know how to improve physical activity among their patients. You know, what do you say to your patients? You know, often it says you need to exercise more. Well, you know that's not going to work. So what can a physician say in a very meaningful way to help their patients become more physically active? And we also worked on a project where we were developing a program to increase physical activity among children, realizing that our young people often are not getting enough exercise, particularly now with all the distractions of electronic toys and screen time that they spend. They need to be more physically active, and so how do you do that? So we helped a community develop some strategies to improve physical activity among their children. So that's a few that came to my mind of projects that I've worked on.
I understand, kind of tying into that, and I think this facility is in downtown Indianapolis. If I'm thinking of the right one, I understand that you were the technical advisor to the American College of Sports Medicine, and which developed what was called an American Fitness Index. Can you tell us about that report?
Sure, I'll be glad to do that. And you are correct. The national headquarters for the American College of Sports Medicine is located in Indianapolis. On Michigan Street is where it's located, near the canal. I led a team from Indiana University to develop the American Fitness Index in collaboration with the American College of Sports Medicine and a panel of national experts that we were able to work with, which was a very valuable experience. What we do is we're measuring the fitness level of the largest cities in the United States. You know, often when we think about fitness, we're thinking about individuals, but now we're thinking about what about a city? What can cities be fit? A fit city? Well, part of that has to do with how fit the residents are, but part of it also evolves around what is the community doing to help support physical activity among its residents. So we developed a report. The first time we did this was in 2008, and we've produced a report every year since then. And the new report will be coming out next month in May, and you'll hear a lot about it because Indianapolis, all the newspapers and media pick up on this thing because we rank the cities from the cities that are most fit to the cities that are least fit.
Yeah, sometimes those rankings are interesting for a couple reasons. Number one, you might have a really good ranking, or number two, you might have a very bad ranking among cities.
That's absolutely true. And as embarrassing as it is, Indianapolis usually ends up toward the low end of that ranking, which is problematic because the American College is here, and of course medicine is located here, and of course there's a lot of people very interested in improving the health of the city, but we don't rank very well. We have improved, I will tell you that. Over the years, we have improved our ranking. We still have a long way to go to compete with some of the other cities that have spent a lot more resources in building their city capacity to help people be physically active. It's interesting to note that about half of the measures that we include in the index are measures of the built environment. That is parks, tennis courts, ball fields, basketball courts, whatever the city has built for the residents to use to be physically active. And we also include the policies that the cities have enacted to encourage physical activity, such as requiring PE throughout elementary, middle school, and high school, for example. Make sure that the streets have bike lanes or walking sidewalks or walking pathways or something of those nature. So all of those figure into our measure, and some cities have done just a whale of a good job in building that infrastructure for their residents. And some cities need to improve some. Now, Indianapolis has actually done a pretty good job in that, I have to admit. There are, unfortunately, many neighborhoods that do not have sidewalks, which makes it very difficult for people to safely walk to maybe a close-by grocery store or something like that, where they might otherwise walk, and so now they have to hop in their car and drive there. So anyway, those are some of the things that we've been doing with the American Fitness Index, and it's been an exciting project, and I'm glad to have been able to work on it.
Well, that's of substantial interest to Indiana Trails and also some of our other partner trails groups and also transit groups around the state of Indiana and the Midwest. Yeah. I want to shift gears just for a little bit here and deal briefly with the current medical situation that we're facing around the country and around the world. And not to put you on the spot here, but really just to get another opinion, because there are so many opinions out there right now about how far this is going to last and so forth. With regard to COVID-19, do you think it will go away like SARS and Zika, or is it a new entrant into the seasonal cluster of diseases?
Well, that's a really good question, and one that no one can answer yet, because we just don't know. However, listening to the experts, and that's the best we can do right now, is listen to experts because we don't have the history yet. The experts do believe that the coronavirus infections will occur every year going forward. And so I think, to be on the safe side, we need to be prepared for that to happen. So next fall, and it'd be nice if it didn't happen, and that'd be wonderful. But I think to be safe, we should go ahead and prepare for the COVID-19 to come back again in the fall. Now, what we really need is a vaccine. So for the coronavirus, just like we have for the flu. And I think if we had that, and also if we had a really good medicines for treatment of people who do have a serious case, so they can survive that and have a normal life afterwards, I think we'd be much more comfortable in moving forward. But we do need those two things, I think, to really make it work for us.
Follow up on that. When we talk about the fall, it brings to mind school kids being back in the classroom, and it brings to mind workers and co-workers, perhaps because of the weather cooling off, being in more closer confines and so forth, people going to more indoor events as opposed to outdoor events. In your mind, is that a no-brainer to make that a connection? To make that connection, or is there something more scientific behind that?
Well, we're just going to have to find out, how this is all going to play out. If, as you know, we've all been sort of ordered to stay home and to stay out of public as much as we can, and so we've been doing that. I know that has had a profound impact on all of us as individuals, and on our families, on our children. Has had a profound impact, and there's such an anxiousness now about trying to get back to the way things were before we had this pandemic. And I think we're going to move that direction. I think that will actually happen. But I think we have to be very careful about that and make sure that we're very thoughtful about how much we open things back up and how often we provide opportunities for the public to gather together in larger groups. So that brings into question things like school. Will school be able to be offered in the way it's been in the past? Well, I think they're going to try to do that. Is the sense that I have, is that the educators realize that having children in the classroom is a much better situation than having them learn as best they can from home. Because a lot of missed opportunities for the teacher to interact one-on-one with the students and to look over their shoulder and make sure that they understand what the students is struggling to do. Plus, there's a lot of social interaction among the students, as well as the teacher and the students, that is missing now. So I think there's going to be a real push to do that. My sense is, Gary, if I were a betting man, I would bet that Some of those group sessions will open back up and continue. People are going to start going back to church. People are going to start children are going back to school. People are going to start going back to work in many ways. What is likely to be a little bit more delayed, I think, would be the very large gatherings for like sporting events, for example, or concerts, or conferences like we had before. And Indianapolis is known for doing all of those things.
Yes.
Great sporting events, great conferences. So we have, and concerts, we have all of those. We have great facilities for that. Although now you're talking about tens of thousands, if not hundreds of thousands of people getting together in one spot. Well, that sounds like a very risky situation if you have a very contagious agent that still hasn't been contained yet. So I'm kind of betting that those kinds of events probably won't happen for a while. Maybe until we do have actually a vaccine and we have a good treatment regimen for folks, maybe we'll start seeing those again. But I don't think that's going. I just personally don't think that's a safe thing to do for a while. So let's say this. Let's say that what's more likely is that the smaller gatherings will come back, like classrooms where you may have 30 or 40 people and students in a classroom, or churches unless they're very large congregations. However, I think a lot of people have learned how convenient it is to go to church remotely and to watch the church service, on their computer screens.
It's a different experience.
Yeah. So they've had that experience now, and they say, hey, this is very convenient. Maybe this is the way to go. So we may see some more of that. I suspect there's going to be some changes in our workplaces as a consequence as well. People who can work from home effectively probably will start doing that more. That will reduce the cost of how much space a business has to rent for their workers and things like that. So I think we will see some good things that come out of this, some changes in how we do things. But I think a lot of what we have done in the past will likely come back to a greater or lesser extent.
Along that line, and let me just interrupt here and say that with some possible time constraints in recording here, I may move this ahead a little bit faster. But connected to what you just said, what effect has the stay-at-home and the social distancing had, especially on people's mental health?
Oh, that's a good question. And I've been reading a lot about this problem. Not only have I been reading about it, I've been experiencing it as well. Probably you have too. I think we all have. Firsthand. We've had some firsthand experience with this because we are by nature a social entity. I think people like to interact together as a family and friends, co-workers, or whatever. And having remote interactions is not the same. We miss doing things together with others because it's more fun to do things that way with other people. And also, being at home and not being able to interact with others, we have a very short list of things that we can do. And so life can get a little monotonous. And certainly it's been very stressful, not only just staying home and not being able to be productive, but also because of what we know to be the economic impact now of staying home and businesses not operating. Plus, we get all this flood of bad news on the television. I mean, that's all you get, basically, when you watch the national news or local news, is a good share of the broadcasts deal with the problems of the pandemic. All of this, I think, is taking a toll on our mental health. Yeah.
In line with that, what's your feeling about outdoor activities and how safe they are, or how safely they can be negotiated when we talk about folks getting out of the house?
Yeah, I think being outside doing anything is greatly beneficial, no doubt about it. And I think we're fortunate, for the most part, during our stay-at-home order, the weather has been fairly pleasant. And so we've been able to get outdoors. I mean, I feel sorry for people who had to stay at home in January in China because the weather was so bad you couldn't go outside very well and do anything. But we've been fortunate in that it's come a little bit later for us, and the weather has actually been, for the most part, pretty good, so we can do that. And you've noticed this, I'm sure, and I've noticed it. A lot more families are out walking on the sidewalks in the neighborhood. They're going jogging or biking together, spending a lot of time together. And I think going outside during times like this is probably instinctive for people. They don't want to be cooped up in their house. They get cabin fever. They want to get outside and do things, which is good. And all that fresh air is really good for us to go outside. It's very beneficial.
And in the process of going outside safely, there is this concern about protecting our healthcare workers and our healthcare professionals. And I know you're going to have some thoughts about that, but it's been discussed a lot lately. And just can you kind of put an umbrella statement on top of that in terms of protecting our healthcare professionals?
Well, they obviously are playing a very vital role, and I think there's a longer list of individuals and professions and workers who are very vital to us right now. And the frontline people in the healthcare industry, our first responders or police, fire, EMS folks, all of those folks are exposed or potentially can be exposed to people who have this infection as a coronavirus. Now, I know that they're doing their best to try to protect themselves by wearing the masks and the face shields and the clothing and whatnot. And they obviously need to continue to do that. I know there's been shortages, or at least threats or concerns about shortages. And so hopefully now the supply's been built up a little bit. Got to protect those people. But it's such a big difference in the way that they used to operate compared to what they're doing now. And the same thing with police and fire. The first responders, they get called to somebody who's ill at a house. Hey, go pick them up in the ambulance. They don't know what they're going to get into, and so they have to dress up in all of this gear to go in, and they do that. And then for the healthcare professionals, they're used to having very much of a hands-on approach. They shake hands, they touch your hand, they touch your shoulder, they let you know that they're caring about you. They can't do that now, and I think that bothers them a lot. So I think, and they're obviously seeing a lot of their patients have very serious complications from the coronavirus infection and passing away from it. And that's got to wear on them mentally to see all that devastation that this disease is causing for individuals and their families. So I feel very sorry for them, and it's made a big difference in how they operate. And I'm sure they'd be happy to try to get rid of some of this baggage that they're carrying around now and get back to a more normal way or the way that they used to. And prefer to operate.
That leads me into a slightly different area here. And I don't mean to ask this as a yes and no question, but maybe something that you can just sort of elaborate on just a little bit. Are you familiar with scientific evidence that outdoor physical activity can be beneficial, at least at times, for treating chronic long-term behaviors like substance abuse, suicidal thoughts, depression, or even ADHD? Does any of that ring a bell?
Absolutely, absolutely. There's a wealth of articles that have been published in this area, actually, in the medical literature. Two things. Activity in general. Physical activity is very good for an individual, but doing it outside is also very good, particularly for certain conditions. And I'll call them mental illnesses as a catch-all for the situations that you talked about with substance abuse disorders and suicidal thoughts and depression.
Yeah, and sometimes it could be just learning disorders as well.
Yeah, absolutely. There's a bunch of those. Here's the thing that's interesting. We have seen, the literature has shown, I should say it this way, literature has shown that what the mental health therapists should do, and they're doing this, is they should urge, prescribe, recommend, I'm not sure what the right word is, their patients to spend some time outdoors every day. And it doesn't need to be for long periods of time. 30 minutes would probably be adequate for many people, but to get outside, it seems to have a big impact on how their brain is functioning. People who have mental disorders, and I'm thinking about the substance abuse disorders and suicidal individuals, those urges to use substances or to think about hurting themselves, they come and they go, the urges do. So when they have the urge, if they need to have a coping mechanism, they need to have a safety plan as to what do they do when they have an urge like this. And this is something that the mental health providers help them develop. And part of that plan, that coping mechanism and the safety plan needs to include and should include doing something physically different, going outside and going for a walk. Go walk around the block, doing something that gets them outside, gets them away from that urge, and then the urge subsides a little bit. This is true for lots of other instances too. Smoking is the same thing. People who are addicted to tobacco, for example, they get urges to smoke. If they can get past that little urge to smoke, then they'll be okay for a while. You know what I mean? And so the same thing happens, I think, with these other mental illnesses. If they can get past that crisis point where they have the urge to do something that they shouldn't be doing, then that helps them get a little bit further down the road. And so I absolutely agree that that's helpful. So there's a lot of literature that shows the value of getting outside and exercising of any sort.
Yeah, and we've seen these stories about certain cultures where they firmly believe that getting outside in a forest has some therapeutic value. Now, that's an interesting discussion, but given the beautiful work of art that's behind you and your memories of walking through that wooded trail, what do you know about the therapeutic values of being out in less developed natural areas as opposed to being on concrete sidewalks downtown? Any difference that you've ever heard of?
Oh yeah, absolutely. I think that's the case. And it's almost intuitive, I think, Gary, in many ways, because think about how much more pleasant it is to walk on a trail, seeing and listening to nature, rather than seeing buildings and listening to automotive traffic going by. Much more pleasant and certainly much less stressful. You don't have to worry about getting run over by cars if you're on a trail out in the middle of a forest. And there's something, I think, very calming about being close to nature, hearing the sounds of nature, seeing the beauty of nature, I think is very calming. Either walking on trails, doing anything outside probably would be helpful. Working in your yard, working in flower garden, whatever it might be. Walking along the beach, if you happen to be close to a shore.
If the beach happens to have been opened up, right?
That's right, if you can get to it. Plus, from a health standpoint, and I'll talk about that, from a health standpoint, the fresh air is so much better for your lungs than air with auto exhaust and other pollutants in it. So it just makes a lot more sense for lots of reasons to be outside. And thinking about trails, what people do mostly on trails is walking. Walking as a form of exercise has been touted as one of the best types of exercise to get.
Where do you place bicycling on that list?
I think bicycling is very good too. Bicycling might be really good for people who can't take the impact on their joints in their legs and feet as well. And so bicycling might be even better for them. And some of the trails, the multi-purpose trails, are set up for that, for biking as well as jogging and walking or whatever. And so I think that's terrific. If you walk, there's less likelihood that if you fall, you're going to get hurt. If you bike and you fall on a bike, there's probably more likelihood you might get some bumps and bruises a little bit. But if you're careful, it's fine.
Yeah. We're going to wrap it up here in just a minute, but I want to ask you for any final thoughts about the emotional, mental aspects of everything that we've just discussed here.
Well, I think we have two things playing here for us. One is the pandemic and the negative impact that's been having on us as a society and on us as individuals, which is a problem. And mentally, having a mental impact on us negatively. And then we have the opportunity, and something that you all are doing with the Indiana Trails is providing resources for people to get outside. And you can do that right now. You can get outside and you can go on trails. We'll follow the CDC recommendations on that, where you stay 6 feet apart from people or more, which you can do on trails. You pass people, you can be as far away as you can from them. You don't want to be real close behind them either. You know, 6 feet that direction too is important, because if they sneeze or cough in front of you, you know, the word droplets can get in the air, and then you'll walk right underneath it and get all that stuff. So yeah,
the 6 feet behind hasn't been discussed as much as the 6 feet lateral spread.
Yeah, but that's important too, though, and especially being outside, because you might have a breeze that'll be blowing and might blow those water droplets actually much farther than 6 feet. Now, I saw some examples where they were measuring droplets going 20 feet or more in the air under certain conditions. So 6 feet is probably a happy medium, and we could probably live with. I don't think we would live with 20 feet. I don't think that'd work very well.
That's a tough one.
No, it'd be tough. But point is, follow the CDC recommendations on that. If you're not feeling well, do not get out and interact with other people. If you've been exposed and you think that you might get the disease, wear your mask. Particularly if you're around other people, you need to wear a mask. It helps protect them and you to some degree, but particularly the other people. So I think following those guidelines would be really helpful. You know, what's interesting, Gary, is that I think we've seen some development of some very good habits that people have had in terms of getting outside and walking during this period of time where they had to stay home. I hope that they continue those habits after we have this opportunity to get back open in our society. And fortunately, most of us live close to a trail, you know, of some sort in our neighborhood, or maybe there's a park not too far away you can go to that has trails. We can easily get to those, and I think we should be more mindful about using them.
I think what you just said about forming some new habits going forward, I see that as being the thesis for one of your next papers or one of your next reports. Anyway, Dr. Zollinger, we hope that you will stay in touch and be available to come back and see us. And thank you very much for contributing your time, sir.
I'll be glad to come back anytime, and it's been a pleasure talking to you.
Thank you.